Now we proceed to ABO blood group testing. The basis of blood group testing is antigen-antibody reaction, and it causes visible agglutination of the red cells, which we call heme agglutination. Okay, visible means we can see the agglutination. There are two phases of the antigen-antibody reaction. The first one is sensitization. The second one is heme agglutination. Okay, for the sensitization, it is a formation of antigen and antibody complex. In this situation, the antibody will bind to the respective antigen, so it will cause sensitization. Subsequently, heme agglutination will occur, in which the red cells will come close together and cause agglutination that we can see. That is what we call heme agglutination. For ABO blood group testing, it involves antigen testing, in which we want to test what antigen do we have on the red cells. This is what we call forward testing. And the second one is antibody detection or reverse testing. So for forward testing, as I mentioned, we want to test antigens on the red cells, and it is usually done at room temperature, in which the red cells tested with antisera. Antisera is a reagent, and it is actually antibody, either is anti-A, anti-B, or anti-A, B. Okay, and then we check for agglutination. For reverse testing, this is to identify the antibody in the serum or plasma. Forward testing is to define the antigen. The reverse testing is to identify the antibody. So in this reverse testing, we test the serum or plasma against red cells that we already know what other blood group is. So we call reagent A or B cells. After that, we will check for agglutination or hemolysis. If there is agglutination or hemolysis, it is a positive test. It is very important for us to remember that forward and reverse grouping should be tally. What do we mean by this? If the forward grouping shows that we have A antigen, so we are blood group A people. So what antibody do we have? We have anti-B, right? So the reverse grouping should give us anti-B antibodies. So that is what I mean by tally. There are few methods to do this: slides, microplate, test tube, and gel cut. During the practical, you will be doing the test tube and gel cut, and sometimes we will give you the slides method. Okay. Principle of testing is, as I mentioned, agglutination or antigen-antibody reaction. So just imagine we are doing forward testing. So we don't know what antigens do we have on our red cells. So just imagine we don't know what antigens do we have on our red cells. So we take the red cells, then we mix it with serum, which is anti-A in one tube, anti-B in one tube, anti-A, B in one tube. So after that, we will see what is the reaction, whether there is agglutination or not. Okay. So if in the tube containing anti-A, there is a agglutination, we know that the anti-A have coated or have sensitized the red cells and cause agglutination. So we know that the antigen on our red cells are A antigen. Okay? So now, for the reverse testing, the similar principle apply. So now it is the other way round. We don't know what is our serum, what antibody inside our serum. So we test it with red cells with A antigen, red cells with B antigen. Okay, so we'll see which one is agglutinated. If we see if the cells with B antigens is agglutinated with our serum, so we know we have anti-B. Okay, it might be confusing for a while, but take your time, do some reading, and during the practical, you will understand this further. If you still not understand, you can ask me during our class. Okay, so this will be the results. Agglutination, no agglutination is a negative result, and red cells agglutination will produce positive results. And we usually do see the reaction using our own eyes without the help of microscope, except for special cases. Okay, discrepancy of blood group testing results. What do I mean by discrepancy? Discrepancy meaning that the result is not tally between forward and reverse grouping. Alright, so let us see what are the causes. What are the causes for false positive results? In false positive results, meaning that we should get negative results, but suddenly it become positive. So the positive is a false positive results. What can be the cause? The cause can be because of the rouleau formation and also autoimmune hemolytic anemia. In rouleau formation, red cells is like a stacking coins, right? And in autoimmune hemolytic anemia, because of that disease, our cells, our red cells, automatically will agglutinate. Okay, so these two causes are the common causes when we see false positive result. Okay, for false negative result, this means that we should have positive results, but it turns out to be negative. So the negative result is the false negative one. So what can be the cause? The first one is important sera, meaning that our sera or our reagent that we use is important either because it is not stored properly or either because it is already expired. So the function is not good or is not correct. The second one is technical error. When we do a lot of testing with a lot of test tubes, sometimes we forget to add in the anti-sera to some tubes. So this can lead to false negative result. And the other one is wrong interpretation. This is particularly happen when it is actually very weak positive. So we are not sure. We take the positive result as negative. So it will cause false negative result. For Rh blood group testing, the principle is the same, the antigen-antibody reaction, but we only test the antigen on the red cells only, meaning that we only do the forward testing. We use anti-D anti-sera, and if it's found to be Rhd negative, we will proceed to determine other antigens such as small c, big C, small e, big E, with using specific anti-sera. The method is still the same, slide, microplate, tube and gel cut method.